Know your vocabulary. Again, most of it repeats itself in my notes that I gave you, right? And again, a lot of it, I told you, was also TM, so. And that's why you go over all the vocabulary. Know your crossword puzzle. It's a good review. Don't forget the GI crossword puzzle has the thing on the bottom too, all right? Okay, and that was it. Okay, let's go over this. Okay, the beginning here for GI, it's just definitions. First one's definition of stomatitis. Get out your notes if it's going to help you. Definition of stomatitis, definition of gingivitis, definition of candidiasis. What's the other name for that? Okay. Pyorrhea affects mainly what? The bone. Yep. Goes from the gums to the bone. Cancer of the mouth. What's that called? What do you see in your mouth? What's it called? Leukoplakia. Mm-hmm. So, signs and symptoms. It's a white patch. Irregular. Okay, so what would be the main problem if you have these white sore areas down your throat? What's that?
You can't brush them away.
No, they don't come off. They don't heal. And you can't swallow. It's hard to swallow. Okay. Disease of the esophagus is GERD. So what's going on with there? What's going on? Backflow of the acid. Right. Yeah, right. The LES, it's not closing properly, right? The cardiac sphincter is not closing properly. And unfortunately, this happens as you get older. It gets worse. So if it's acid going into your esophagus, what's the main symptom would you have? Heartburn, pain, right? And I said there's burning behind the sternum. And I just want to let you know, I wrote it down because FYI, because a lot of times they think you have breathing problems because you have coughing and wheezing, but it could be just GERD, which is very common. I'm trying not to tell you what to do about it, but okay. Main diagnostic tests, because it's acid, they'll do a barium swallow and a pH test. Yeah, that's the main two. Achalasia, what's the other name for achalasia? Cardiospasm. So it's the LES sphincter that's spasming, right? So think about it. If it's closing and spazzing, what's going to happen to the esophagus? It dilates, right. Okay. So food feels like what? Yeah, it's not going through, so I feel like it's being stuck there. Okay. So of course you're going to have dysphagia, obviously, right? I mean, that's a given. Again, they're going to check, they need a scope to look at it, right, to see. Just like they have for GERD, you still have to see, but then again, the barium swallow. Okay, cancer. Cancer, you have to think about cancers, because a lot of these things are repeating each other. It's anything that irritates you. Okay, so it's whatever you're swallowing that irritates your throat. So, and you know what that is when you drink it. The big common one is alcohol. When you smoke, it really, you've heard of a smoker's cough or their voice. Have you noticed that? It does. You know, you can usually recognize someone who smokes because it's irritating that area. And those are the two main things. So signs and symptoms of your cancer esophagus, again, dysphagia again, right? For all of them. Painful difficult swallowing. Of course, if cancer is worse, as far as the swallowing, right? If it's cancer, a lot of pain, bless you. So you're gonna lose weight. Okay. Again, they're gonna scope you, but they're gonna have to never, when you think of cancer, in order to find out what it is, you have to do a what? Biopsy. And we had pictures for most of these. Okay, there's something else I wanted. Okay, then esophageal varices. And varices refers to what? So they're dilated. Okay. And this is related to what? Cirrhosis. Secondary to what? Right. So vessel hypertension we talked about with cirrhosis. So because these veins are dilated, they can rupture slowly, and I told you that was days, or suddenly. So you don't want the dilated vessels, just like with hemorrhoids, you don't want putting pressure. So no what?
Strain.
No strain of any form, which would be like coughing, sneezing. You try and get them to not do that. Okay? Because its blood vessels are dilated and they're kind of like oozing, or they can rupture. You're going to see emesis with what? Blood, obviously. Okay. Again, they're going to have to scope you. They got to see what's going on. Okay. Hernia, a picture of that. Okay. I'm telling you the main things you need to know, okay? You can mark it, underline, highlight, however you want to do it. A hernia, protrusion of the stomach through what? Because the diaphragm is what? It's weakened. And that's like any hernia. The abdominal area, so the abdominal wall is weakened. Here it's the diaphragm. Okay? Pretty much asymptomatic, but you could have heartburn. Like I said, we used to give like things like Riopan, just anything that would coat the area for heartburn, for hiatal hernias. We had a ton of people diagnosed with this in the hospital, and they were in the hospital for it. Of course, everything's outpatient now, but it's pretty common. I think your book says it's pretty common as you get older too. So, gastritis, of course, that you know that's inflammation of the stomach. You know, gastro means stomach. Okay, good. Okay, again, it's anything that irritates the stomach when it's inflamed. Again, you have alcohol, smoking. Okay, but it could be infection. And if you notice, you can have foods that irritate your stomach. More and more people are getting sensitive to foods because they put a lot of chemicals in our foods, you know, and harsh fats and stuff. Okay, so you saw, remember the picture? It was really bright red. Okay, so if it's inflamed enough and irritated enough, you could throw up what? Blood. You have hematemesis. And that includes either bright red blood or coffee ground. If it continues digestion through your system, and the stool, what's that called with blood in the stool? What's the word again? Melanoma. All right, peptic ulcer, called peptic ulcer disease. And again, this is common in people who are what? What age? Aged, they can refer to as aged, older. I don't know what age it is, but it means you're old, okay? Right? Okay, so that's where you're going to see it. So these ulcers can go through all the different layers, right? Into the stomach, or even the duodenum. But anyhow, they found out with peptic ulcers, again, it's the stomach and duodenum. One reason they found out they're commonly caused by what type of bacteria? H. pylori. Okay. Also, there's an imbalance of what? Two things in your stomach: hydrochloric acid and
The Pepsi.
And you want a balance of the acid and the, I can't hear you. Think what the stomach does. What all the different cells form acid. Yes, there's cells that form acid. But what's the other one that keep it in balance? Huh? No, not pepsin. H plus. Mucus. Yeah. Right. If there's imbalance of the acid and the mucus, remember what's the mucus do to your stomach? What's it for? It protects you. Right. So if there's not a balance of the acid and the mucosa, you're going to end up with a hole in your stomach. All right? So the bacteria affects this, but also other things affect it. And it's listed here, that you need to know. Taking that should be TOO, taking too many NSAIDs, and that includes aspirin. A lot of people forget that's one of them. Smoking. Anything that irritates, tobacco, that's smoking, well, I guess it's chewing maybe. Alcohol, stress, and then I told you also caffeine. If you notice you drink too much caffeine in any form, you're gonna get sick. A lot of people. So you need to get off of those if you have this problem, okay? Okay, if you're thinking, gee, your stomach's killing you, are you gonna be able to eat? No. So what's gonna happen? We lose weight. Okay. And it goes through the whole layer, so you're gonna have bleeding, right? Obvious, right? If it goes all the way, as it goes through, you're gonna be hemorrhaging, right? Okay. So I told you it's hemorrhaging with hematemesis, and that's a serious complication is the coffee ground emesis. It's digestive. Yeah. Main diagnosis is, of course, you got to see what's going on in your stomach or your duodenum, so you need to see it, right? So scope. That's just saying the scope goes down your esophagus, gets into your stomach, and if need be, go to your duodenum. That's where the ulcers typically are, the stomach and the duodenum. And we showed you pictures with that. So you guys had the pictures, actually. Okay? Cancerous stomach, it's usually silent. It's called gastric cancer also. Again, the cause is the same thing. Anything that irritates a lot over a long period of time. Again, you have your alcohol, your nicotine, your smoking. But anyhow, and a lot of foods. Because you eat how many times a day, right? If you're eating bad foods, yeah, a lot. A lot. Good. But if you're eating bad foods, I'll give you an example. If you change to a very healthy diet, and this happens all the time, and you go back and eat something like a McDonald's, it hurts your stomach. Your body's saying, this is not good for you, it hurts, don't do it. But your body doesn't acclimate. I'll never forget, I'm mainly Scottish, English, so I was raised with very plain food. Then I started dating and going out to fast foods, you're a teenager, and my mother-in-law was a Southern cook. I had horrible stomach aches all the time from the Southern cooking. But eventually I loved the food though, it tasted good, but I adjusted to it.
This kid I work with, his mom just told him he had the American flu because he just came back from like a missionary trip.
Mm-hmm.
He started eating here and he's been sick.
Yeah, like I never was sick in my life, and then when I started switching those foods, I never put two and two together. I started having all kinds of medical problems. So these are things that cause cancer, and unfortunately, as you can see, it's silent. Okay, prevention. You see what's prevention. I won't even discuss it. Okay, I'm trying to scare you to start eating healthy. Because if you do, you prevent all these diseases we're talking about.
I've gotten my boyfriend to eat vegetables and that's it.
Yeah. Okay, signs and symptoms, the main signs and symptoms. Remember, it's either not having the pain at this point. As far as the cancer goes, you may have your normal pain from eating bad food, but you have you know, you're gonna end up with weight loss with it, okay? And Emma says because the cancer will eventually spread and go deeper, causing the blood. And of course, it's cancer, so the main thing to diagnose it would be biopsy, yeah. I mean, doctors will try different stuff to see what it is, but that's the. Okay, now disease of the small and large colon. And this is where you have to pay attention to the different ones because there's so many different ones with the intestine. Ulcerative colitis, ulcerative refers to what? Inflammation of the colon, and what's ulcerative mean? Ulcers. So it's inflammation and ulceration of mucosa in the colon and rectum. Colon and rectum refers to what part of the body? Large intestine. So it's mainly the large intestine. It is the large intestine, with the main one being this, which one, the sigmoid, right? Okay, look at this. It's stress induced. That's a biggie. Signs and symptoms. You guys have to figure out the difference for all these different ones by the stool. This is the stool because there's ulcers and it's inflamed. You have that diarrhea with the pus and blood. If you remember, go to the bathroom 15 to 20 times. So that's going to lead to what?
Dehydration.
Dehydration. Just makes sense, okay? It could do that too, yeah. Because and to diagnose, the main thing would be oscopy, right? And since it's mainly the sigmoid, it really is. It's a sigmoidoscopy. Okay, now as a nurse, this is important to know too. You gotta check for, it says cramping. That's tenesmus cramping. I told you add on distension. And of course the stool. Blood and pus in the stool. Okay. Crohn's disease affects what part of the GI system? All of it. All of it, but mainly small intestine. And you saw the picture, it was up here on the left side here. It showed bright red areas all over the small intestine, a little bit in the large. You know, because it can affect the whole GI system, but mainly the small. And you get these lesions, and it thickens those areas. Look at this is important. It's increased also by stress. Your book says autoimmune. I guess there's information that could be genetic at this point. Okay, so then what's the difference in the stool? It's affecting the whole GI. The stool has what? Fat. What's the word for fat? Diarrhea. Again, to diagnose, you're going to do oscopy, right? Yeah, you have to see what's going on. Okay, we don't have to do constipation or diarrhea, right? Well, constipation, you know, is hard stool. The main drug that causes it is what? Opiates. There you go. Diarrhea. The stool is what? Watery. What's the main cause of diarrhea? Very good. Infection. I just gave you an example there because people tend to remember C. diff when they have a patient with C. diff, right? It's any infection. We've all had diarrhea, right, through it, and some type of infection. It spreads really quick in the nursing homes. Okay. Diverticulosis. What do you see on the bowel? Pouches. Yeah. Diverticulitis is just inflammation of the pouch, which is a diverticula. Okay. Okay. It's mainly in the sigmoid. Signs and symptoms. What's happening with the bowels? It's a change in bowel habits. So it'd be like you could have diarrhea, you could be constipated, back and forth. Okay. Again, main diagnosis is or sigmoidoscopy, right? Specific is sigmoidoscopy. That's where it typically is also. Remember the picture it showed you. If you look at your pictures, it gives you an idea. You can circle whatever, make a note. It does help. Next one's appendicitis. Where's it located? The appendix.
Off the seat.
Off the cecum, which is what part of the bowel? Oh, okay. Lower right. Left or right? Right, okay. Okay. And you notice inflammation of the appendix. Let's go that. What's the main sign and symptom?
Increased fever.
Okay, low fever, but it's a low-grade fever, not a high fever, it's a low-grade fever, and elevated white blood cells. What about
Loss
rebound
of
tenderness? Yep, and where at?
Right.
Which is where the appendix is located. There you go. Another bowel thing, irritable bowel syndrome. Now this is not as extreme. A lot of people have it. Again, you have, the main symptom here is the bowels are real active and you're cramping, okay? Which you can see as constipation and diarrhea, but the main diagnosis again is the scope. Okay, then you have peritonitis and inflammation of the peritoneum, obviously, which is what? Lining of the abdomen. It's the membrane lining. So, know your A and P. And because all the things we've been talking about, all of them, they can all lead to peritonitis if they break open. Like a diverticula, if it breaks open enough, inflamed enough, the stool will go into the peritoneum, right?
Right.
Crohn's disease is so bad, it can open up. All of these, constipation, bad enough, it can split the bowel. All these can lead to peritonitis. Appendicitis, it breaks open, right? So, any of these. Anyhow, what you need to know is the definition and then signs and symptoms. You have, again, rebound tenderness. And the pain is how bad? Really bad, severe. And if, like I'm just telling you, you need to know this, all these things that happen with the peritonitis, with things breaking open, you hemorrhage also, right? So know the signs of shock. I've been telling you over and over that you'll see that in state boards, you'll see it in your neck. You start testing, blood pressure goes what?
Down.
Pulse goes, skin is
Clammy and cold.
clammy and cold. You get real restless. And how about your abdomen? With this area, right? Because you can hemorrhage anywhere, right? But your abdomen, you're gonna get distended. Yeah. Okay. Paralytic ileus. Ileus means what? The bowel's what? It's not working, it's not moving. So you have no what? No peristalsis. Mechanical, or no, let's start with non-mechanical. Okay.
Now, in my notes, I wrote next to this one, but I could have wrote it in the wrong spot. You said something's causing a block. Is that for non-mechanical or is that for me?
Something that actually causes the block, whether it's a twist or a strangulation or a constipation, that's mechanical because it's blocking it. Non-mechanical is it slows it down for some reason. Non-mechanical is abdominal surgery. Non-mechanical is anesthesia. Or it says peritonitis. It's causing, it's messing up your body in some way that the peristalsis goes way down.
I was overthinking it again.
Yeah,
Like
that's all it
something's
is.
causing the block.
Yeah.
Oh, it's, the person's not active. That's what I was like.
Yeah. If you're not, people who are like bed rest, decrease, things can slow down to the point causing problems. Narcotics will slow the peristalsis down. And there are some drugs that will slow the peristalsis way down. of course, when you have a drug like that, they'll give you another drug to do that. You have a side effect, they'll give you another drug, and on it goes. So, mechanical is, yes, remember those pictures we showed you? The twisting is called what? Like I said, most of these vocabularies are in this in this handout. Incarcerated, hernia. It's trapped out. It's trapped. It can't. Yeah, it's a loop of the bowel that can't be returned, right? Right?
Right.
Okay, since we're talking about GI. And then constipation. It'll eventually cause a block if it's bad enough. So the main sign and symptom would be what? Okay, pain, but how are you gonna figure out what it's going on? No bowel sounds. Right? There'd be no bowel sounds. Yeah.
Is this where you said 60% is caused by adhesion?
Oh, that's, yeah, adhesions, like adhesions wrapping around it, yeah. They found out most of mechanical ileus, paralytic ileiuses are from adhesions. Endometriosis is a big cause, and then past surgeries cause adhesions. Those are just the two main things off the top of my head. Yeah. So paralytics, obviously, yeah, it'll be pain. Definitely there'll be pain. Because remember we talked about this earlier, if the bowel is blocked and not moving, it's gonna go backwards, right? You're gonna be wanting to throw up all the time, and you're gonna have horrible pain. Okay. And no bowel sounds. Okay, hernia. Says definition, protrusion of the intestine abdominal wall. Okay, there's these words you need to know. Strangulated, blood supply's cut off. Now that's serious, right? Because what's going to happen to the tissue? It'll die. Incarcerated, it's trapped outside the peritoneal cavity. Reducible, that means it can't, now incarcerated, it can't be reduced. If it's reduced, it means hernia can be moved back into peritoneal cavity. Do you do that as a nurse? No, if you see something sticking out, let the doctor know. That shouldn't be sticking out. And you do see that we were at Caprice on the vent unit. We looked at this abdomen, there's this big lump. And the student's about to touch it. She wasn't gonna do anything, but
Feel
she just wanted to feel it, but you don't try to put it back, I know they try to put back uteruses when they come out. I've seen people. I don't think I want to do that. No, I let the doctor do it. Okay, again, signs and symptoms. Yeah, you'll have pain and pressure. Abdominal will be distended. Cancer of the colon. It's the second leading cause of death. Cause is unknown, but they think it's a dietary factor. And of course, diagnosis is mainly through biopsy, right? Hemorrhoids, definition. Veins are what?
Dilated.
Right, and they're internal and external. I think everybody knows about this. The main diagnosis is through what? Proctoscopy. Yeah, by scope, it's just proctoscope. Anal fistula. Definition, know these definitions? Tube-like passage. Yep. And we talked about fistula in the lab, and a fissure is just an ulcer or crack. And anyone who's had diarrhea probably had a fissure. It irritates the skin on the outside so bad, you might have a little bit of bleeding because it cracks the skin, that's all. Right, a fissure? Just a little opening, that's all it is. Okay, now the diseases of the adjunct organs versus cirrhosis. Okay, again, the definition has fibrous scars, right? They keep growing until the blood flow is restricted, right? Okay, so it's just fibrous scars from different diseases, which affects the function of the liver, basically. And this leads to what?
Ammonia buildup.
Ammonia building up. And they call that what? Hepatic encephalopathy. Pneumonia builds up, and what type of tremor do they have? Asterixis. And it's flapping of what? Your hands. You'll see the hands. Go to Caprice. Kind of watch your patient to learn all these symptoms, okay? Okay, cirrhosis forms fibrous tissues. Tissue decreases. That leads to, when the liver is no longer functioning, toxins build up. It's called hepatic encephalopathy. The main symptom you see is asterixis. Okay. Causes. Again, you probably always heard of alcohol, right? But also drugs, narcotics, medications, infections, and obstructions. Okay, so know that. Okay, signs and symptoms. Okay, one of the main signs and symptoms you see with any effect of the liver is jaundice. Right? Jaundice of the skin, jaundice of the eye. Second one is, I told you about, is where the fluid accumulates. Ascites. I told you could probably get an idea who has cirrhosis when you look at a lot of, usually I see it on men more so, you can see it better. The spider veins around their nose and cheeks. They have liver problem of some sort.
Now, is the spider, I was trying to look it up last night, because you had said something in a in parentheses for Nevius. Is that?
Nevus, yeah.
Nevus? That is the technical term for spider?
For spider vein, yeah. Okay. Then I told you to write down, you're going to see through cirrhosis and hepatitis. Yeah, esophageal varices. Yeah, as these fibrous tissues form, the pressure builds up around the circulation. Yeah, and if you look at the way the vascular system's set up, it goes to the esophagus and you get esophageal varices. Okay. Diagnosis is biopsy. Yeah. And they'll do a paracentesis. That's the two main ones. Hepatitis, you know it's inflammation of the liver, right? Obviously, you know what hepata means liver. Okay, there's 4 types, A, B, C, D. Know those 4. And you guys know what A and B are right off, right?
Yeah.
A is from contaminated food or water. B is from body fluids of any form. What's that?
B is body.
B is body. That's a good way to do it.
8.
And C, you probably know it's from drug needles. Okay. Okay, signs and symptoms. Again, you have the hepatic encephalopathy. Toxins are building up. Main toxin again is what?
Ammonia.
Okay. Then you have ataxia. That's another word you should learn. Ataxia for no bleed. And asterixis, which is, and it's written here for you, flapping hands, as a tremor. Okay. Diagnosis, don't worry about it. It's mainly blood work they're going to have to, right? Obviously, you're going to have to do blood work, right? And see what's going on. Cholecystitis. Inflammation of gallbladder, definition. I think you guys know most of this definition. Where's the gallbladder located? Which side of the body? Right upper, so that's where the pain is, and the pain radiates where? Back and right shoulder. Yeah.
First line.
Okay, the other main problem is indigestion of fat intolerance and jaundice. Okay, because the stones are blocking the common bile duct, which goes to the liver. Okay, do you remember A and P? Okay. With fat intolerance, you're going to see stools with fat, and that's called what?
Granuria.
And the stools are clay colored, and that's called what? Acolic stools. So, again, diagnosis, the symptoms and the stool, obviously. A cholelithiasis, that's your stones. So you have the main thing is you have indigestion after eating what? What type of foods? Fatty foods.
Also,
Gallstones.